Welcome, feline fanatics and curious minds. Today, we're tackling a topic that often sparks questions and sometimes a little bit of fear: Toxoplasma gondii infection in cats, commonly known as toxoplasmosis. We'll demystify this parasite, explain its journey through the feline world, and most importantly, address what it means for your cat and for you. Let's dive in. First things first, what exactly is Toxoplasma gondii? This is an obligate intracellular coccidian parasite that has a remarkable ability to infect virtually all warm-blooded animals, including us humans. But here's the crucial detail: domestic cats and other felids are the natural or definitive hosts. Non-feline species, like rodents and birds, only serve as intermediate hosts. The parasite has three main infectious structures: sporozoites, found within oocysts, which are shed in feces; tachyzoites, the actively multiplying stage, found in tissues and milk; bradyzoites, the slowly multiplying stage, enclosed in tissue cysts, also found in tissues and milk. So, how do our cats typically get infected? Well, most cats become infected by ingesting intermediate hosts, like rodents, that are carrying these tissue cysts. When a cat eats an infected rodent, digestive enzymes dissolve the cyst wall, releasing bradyzoites into the cat's stomach and intestine. This kicks off what's called the enteroepithelial life cycle, which is unique to felines. Within 3 to 10 days of ingesting these tissue cysts, the cat can start shedding oocysts in its feces. These oocysts are not immediately infectious. They need to be exposed to air and moisture for 1 to 5 days to sporulate and become infectious. While ingesting infected tissue is the most common route, cats can also become infected by ingesting oocysts directly from the environment. In rarer cases, transplacental infection can occur during pregnancy, leading to infected kittens, and lactogenic transmission through the queen's milk is also suspected. Now, let's talk about the clinical disease, toxoplasmosis, in cats. This is where things get interesting, because despite the infection being common, up to 50% of cats, especially free-roaming ones, have antibodies indicating infection. The clinical disease itself is quite rare. When clinical signs do appear, it's usually in specific situations. Immunosuppression, this is key. Clinical signs commonly appear when a cat becomes immunosuppressed, which can reactivate dormant cystic stages of the parasite. This has been documented in cats infected with feline immunodeficiency virus, FIV, or feline leukemia virus, FALV. Certain drugs, like cyclosporin, used for renal transplants or dermatological conditions, have also been linked to clinical manifestations. However, commonly used doses of glucocorticoids typically do not predispose to reactivation. Congenital infection acquired during gestation tends to be much more serious than infection in an adult cat. Kittens infected this way often develop severe signs, varying with the stage of gestation at the time of infection, and frequently die from pulmonary or hepatic disease. Some of these newborn kittens might even shed oocysts. The areas of the body most commonly affected by toxoplasmosis include the central nervous system, CNS, muscles, lungs, and eyes. Cats can show a range of signs such as neurological signs, seizures, ataxia, behavioral changes, altered mentation, blindness, and vestibular signs. In fact, toxoplasmosis is the second most common definitively diagnosed infectious disease of the feline CNS. Muscle hyperesthesia, extreme sensitivity or pain. Dyspnea, difficulty breathing, due to lung involvement. Ocular issues, uveitis, chorioretinitis. Less commonly, hepatic, liver, and pancreatic involvement. Other general signs can include icterus, jaundice, diarrhea, fever, depression, anorexia, and weight loss. Diagnosing toxoplasmosis can be a bit tricky because the clinical signs aren't unique to this infection. Oocyst shedding. Detecting oocysts in fecal samples via microscopy can confirm shedding, but T. gondii oocysts are morphologically indistinguishable from those of other parasites like Haemondia haemondi. So, identifying the parasite doesn't automatically mean T. gondii is the culprit. Definitive diagnosis. A definitive diagnosis of the disease toxoplasmosis relies on finding the organism itself in body fluids or tissue. This can be done by detecting tachyzoites in samples through cytology or polymerase chain reaction, PCR. Samples might include cerebrospinal fluid, CSF, aqueous humor from the eye, fine needle aspirates of organs, or bronchoalveolar lavage fluid. Antibody testing. Antibody tests are widely available for IgM and IgG isotypes. All infected cats will develop IgG and IgA antibodies. IgM antibodies can indicate a recent or active infection, but they are also commonly detected in healthy cats and don't always correlate with clinical signs. Significantly elevated IgG titers, especially a fourfold rise over 2 to 4 weeks, can suggest recent or active infection, but elevated IgG alone can simply mean previous exposure. It's crucial to remember, the presence of antibodies does not prove clinical toxoplasmosis. For CNS disease, CSF antibody titers are considered more reliable than serum titers for diagnosing infection within the brain and spinal cord. Imaging and histopathology. MRI findings in neurological toxoplasmosis are nonspecific and often show multifocal lesions. Histopathology typically reveals inflammation and necrosis, with the demonstration of protozoal tissue cysts being strongly supportive of diagnosis. Here's a critical point for understanding the human risk. A cat that has antibodies to T. gondii no longer sheds oocysts and therefore does not pose a risk to humans. Antibody development usually takes 2 to 3 weeks, by which time the cat has typically stopped shedding. A cat sheds oocysts only once in its lifetime, generally for a short period of 3 to 10 days after ingesting tissue cysts, or up to 18 days if it ingested oocysts or tachyzoites. If your cat is diagnosed with clinical toxoplasmosis, treatment is available. Clindamycin is the treatment of choice. It's typically administered orally at 10 to 12 mg/kg twice daily for 4 weeks. For cats with systemic disease or uveitis, clindamycin is often combined with topical, oral, or parenteral glucocorticoids to manage inflammation and prevent secondary complications like glaucoma. While clinical signs not involving the eyes or CNS may improve within days, CNS and ocular toxoplasmosis tend to respond more slowly. Prognosis is often poor for pulmonary or hepatic disease, particularly in immunocompromised animals. It's important to note that treatment is unlikely to completely eliminate the organism, so recurrence is possible. Prevention of T. gondii infection in cats primarily involves reducing their exposure. Diet: feed your cat commercially available, processed food. If you feed raw meat, it should be thoroughly cooked or frozen, as freezing or irradiation can kill tissue cysts without affecting meat quality. Hunting: preventing cats from hunting and eating intermediate hosts like rodents, cockroaches, or earthworms is crucial. Keeping cats indoors can significantly reduce this risk. Environmental access: discourage cats from entering areas where food-producing animals are housed or where feed is stored. Now let's address the most common public health questions: the risk to humans. This is where many misconceptions lie, often leading to unnecessary worry, especially among pregnant individuals. The primary source of T. gondii infection in people is the ingestion of undercooked meat containing tissue cysts, particularly goat, mutton, and pork. The second most common route is ingesting sporulated oocysts from the environment, for example, through contact with contaminated soil or by eating unwashed fruits or vegetables. Waterborne outbreaks from oocyst-contaminated water are also reported worldwide. The risk of infection from cats is generally low, with exposure to environmental oocysts posing a more significant health risk than direct contact with cats. Remember, cats only shed oocysts once in their lifetime, for a short period of 3 to 10 days. Cats that have antibodies to T. gondii are no longer shedding oocysts and do not pose a zoonotic risk. Research shows that contact with cats has no influence on the probability of people developing antibodies to T. gondii, whereas consuming raw meat significantly increases that risk. Even veterinarians working closely with cats are not more likely to be infected than the general population. Also, stroking a cat will not spread the infection, as oocysts cannot be found on their coat, even when they are shedding. For households with immunocompromised persons or pregnant women, specific hygiene recommendations can further reduce any potential risk. Litter trays should be emptied daily, as oocysts need 1 to 5 days to sporulate and become infectious. Wear gloves when handling cat litter, and wash hands thoroughly afterwards. Clean litter trays regularly with detergent and scalding water. Dispose of cat litter in sealed plastic bags. Keep cats indoors to prevent them from hunting and consuming intermediate hosts. Do not feed cats raw or partially cooked meat. Test cats for T. gondii antibodies. Cats with antibodies have already completed their shedding period and are not a source of infection. Cats without antibodies have not been infected previously and could shed oocysts if newly infected, so keeping them indoors during pregnancy or owner immunosuppression is advisable. Before we wrap up, let's briefly touch on the role of avian species as intermediate hosts. Birds, both wild and domestic, are important in the transmission chain of T. gondii. A recent study found infection in 24.1% of wild birds and 41.4% of backyard chickens. Species like rooks and hooded crows showed high infection frequencies, suggesting corvids may be good bioindicators for the parasite in urban environments. Cats preying on these infected birds are a significant way the parasite continues its cycle. The study also highlighted that diet alone might not be the primary risk factor for birds, but environmental contamination, such as from infected rodents and water, plays a crucial role. So, to recap our key points. Toxoplasma gondii infection is common in cats, but the clinical disease, toxoplasmosis, is rare. Clinical signs usually occur when cats become immunosuppressed, leading to the reactivation of cystic stages, or in congenitally infected kittens. Commonly affected sites are the CNS, muscles, lungs, and eyes. Cats with T. gondii antibodies no longer shed oocysts and pose no zoonotic risk. The primary source of human infection is undercooked meat or environmental oocysts, not direct contact with cats. Good hygiene practices are effective in minimizing any potential risk. Understanding toxoplasmosis helps us appreciate the complex relationship between cats, wildlife, and human health. By staying informed and following simple prevention guidelines, we can ensure a healthy coexistence with our feline companions.